Okay, and it is recording. So.
It says a non-working number.
Good afternoon, everybody. Just wanted to check in with everybody. We are just waiting for people to finish joining. There has been a large number of attendees for this particular group, and so we're just trying to make sure that people are able to get in. And so we will start in a few minutes. So just please bear with us for a little bit. Thank you. Hey, good afternoon, everybody. We have had, as I mentioned earlier, for those who were on when we opened the meeting, we've had quite a few people who are joining. We still have some people who are joining right now, and so we're letting them on in. But we do have, since we have so many folks, and we want to make sure that we're valuing people's time, we're going to go ahead and get started. So again, my name is Dominic Zerlo. I'm the director for the New Mexico Department of Health Center for Medical Cannabis and Psilocybin. And we have a few of our team members who are here today. And I'm going to go ahead and ask them to introduce themselves. Jorge, why don't you go next?
Hello, good afternoon, everyone. I am Jorge Gonzalez, the Medical Psilocybin Program Manager.
Thank you, Jorge. Brenda?
I am Brenda Burgard, and I am chairing this meeting for education and training for psilocybin.
Thank you, Brenda. I actually had meant our staff member, Brenda Martinez, but that's a great thing, and I'm glad you introduced yourself. That'll save me from doing it here in a minute, but go ahead, Brenda Martinez.
Absolutely. Good morning. Good afternoon, everyone. Brenda Martinez. I'm the Deputy Director here at the Center.
And we have Dr. Robert Truckner.
Hello, everybody. I'm Robert Truckner. I'm the medical director for the Medical Psilocybin program here in the state of New Mexico. Happy to join you.
Carmen
Hello, everybody. I'm Carmen Batista. I'm a health educator here with the program.
and Katie.
Hi, good afternoon, everybody. My name is Katie Freitag, and I'm also a health educator here with the program.
Okay. And so just would like on behalf of the department to welcome everyone. This is the committee of the Medical Psilocybin Advisory Board. This is the Training and Education Committee. And as introduced earlier, Brenda Burgard, who is the chair for this committee. And with that, the Department of Health is here to administratively support so that we will help with the logistics and other issues. As we move on forward. But Brenda, this is your meeting, and so go right on ahead. And just a quick question, Brenda, for the slides, would you like me to present them and move them forward, or did you want to go ahead and present?
You go ahead and present it.
Okay.
And
Perfect.
so again, let me introduce myself. I am Brenda Burgard, and I am a licensed clinical practitioner for therapy, and here at licensed in New Mexico and part of the board of the Medical Psilocybin Advisory Board. I want to welcome everyone to this meeting and help with participating and working together on establishing a program for education and training in New Mexico psilocybin program. It will be uniquely meeting medical safety and ethical standards while including native and traditional healers and other practitioners. And there's a lot that we need to cover in a very, very short time. And I want to start with practitioners that are already trained. I'm kind of curious. So I want to see how many people here today have been educated in psilocybin training. If anybody could raise their hand, we could just take a little number here of, who sought training for psilocybin or any other psychedelic training. And maybe you can do the count for me, Dominic.
Sure. So people are still raising their hands, but we're already at 17 at this point. Sorry, we're at 18 now, 19. Okay, so it looks like about 18 or 19 people.
And I'll raise my hand here.
Yeah, that's why I'm kind of thinking. And that's with 30 attendees outside of the DOH team. So yeah, that's really wonderful to see.
And still people are being admitted. So this is very encouraging because I wanted to get an idea of how many people have been wanting to get trained for this and get ready for this, because I think people kind of knew that New Mexico here in the future, and here we are, may be doing a program like this. And like myself, I always hoped that New Mexico would get on board with psilocybin, at least, to use that in a medical profession. So I think this is wonderful so far. So let me see where I left off. So there's a lot that we need to cover in a very short time, and unfortunately, a lot of this stuff is dry and boring at times. I'll try to make it as interesting as possible, but we need to be thorough in our approach to making a program that will serve the community. And the goal here today is to go over what is needed to get started and to roll out guidelines for those who have training to be the first in line to begin the process. I know there's going to be a lot that I left out, and this is wonderful that we're doing this in a public forum, because people can come in and add what they need to add to this document that we'll be looking at here later on. So for right now, we'll be covering the basics, because we are also offering this to the public too for information. So this PowerPoint that I have is fairly basic, just to get an overview of what we're going to be doing at the Department of Health here. and what our expectations and means to deliver these goals. And additionally, reciprocity qualifications will be met while fulfilling the expectations of the DOH and allowing us to begin offering professional training services to New Mexicans as soon as possible. So first off, we're going to present the basic PowerPoint and what the subcommittee responsibilities, which is everybody that's coming here today. Reciprocity, the working document that I'm going to be presenting today, what those bottlenecks look like, getting ideas about how to make this flow, make sure that we don't miss any steps, especially when it concerns safety. Creating a curriculum, who's going to be teaching, supervisors, practicum, what all that's going to look like. Where will training take place? And I have a couple ideas there too. Clinics, colleges, places of worship, or environments with the DOH approves. And I was thinking, I was looking at a map of all the locations where the Department of Health has offices throughout New Mexico. So that's just an idea, maybe having something where we could teach at those locations. So these are just some big ideas that I have, but I definitely need everyone else's input on this. So the purpose of this meeting today is review the proposed framework for education and training in psilocybin-assisted mental health care, clarify scopes and roles and guiding principles, and align framework with the New Mexico Department of Health advisory norms and public health standards, and identify areas for feedback, refinement, and the next steps. So let's go on to the next slide here. Okay. And why this framework exists. The purpose is create safety, ethical, culturally respectful education and training, support public health, community well-being, accountability, align with New Mexico Department of Health advisory standards, and prepare for evolving law, research, and practice. Okay, next one. All right, what this framework covers. And of course, this is just the basic overall framework of what we're going to be doing as far as training goes. So two parts. The first part is education, the foundational knowledge for all roles. Part two, training skills, competencies, supervised practice, includes practicum, designed to support safety, equity, cultural respect, and regulatory readiness. And let's see the next slide. Okay. And who this is for: intended participants, mental health clinicians, indigenous healers, and cultural practitioners, pastors, clergy, chaplains, spiritual care providers, death doulas, end-of-life professionals, medical providers, co-facilitators, paraprofessionals, and community policy and program leaders. And the next slide. Guiding values, the core principles, safety and ethics, equity access, cultural humility, respect, trauma-informed care, interdisciplinary collaboration, evidence-informed practice, and clear scope of practice. And next. And the education overview of foundational learning, shared baseline knowledge for all roles, didactic and education only, not practice authorization, supports public understanding, safety, informed participation, and this is required before advanced training. Next. What people learn in part one, key topics, history, culture, context of psilocybin, basic brain and psychological effects, mental health and spiritual care applications, safety, screening, and risk awareness, ethics, consent, and power dynamics, and legal regulatory overview. And next, okay, part 2, training overview. Skills-based training, role-specific pathways, supervised, competency-based, builds a preparation, support, and integration skills, and does not expand legal or professional scope. Training pathways, role-specific tracks, therapists and mental health clinicians, Indigenous healers and cultural practitioners, clergy, chaplains, spiritual care providers, death doulas, end-of-life professionals, medical providers, and co-facilitators and paraprofessionals. Reciprocity and accountability, recognizing prior training, supports reciprocity from other states or programs, review of certificates and transcripts, curriculum and supervision, licensure, ordination, or endorsement, and does not override New Mexico law or licensure. Oversight and next steps, governance advisory of the New Mexico Department of Health designated oversight, Indigenous clinical and medical community voices, ongoing review as evidence and policy evolve. And then the next steps is community feedback, refinement, and responsibility implementation. So I know this is a lot. We're all rolling out. It's like coming like an avalanche here. And so this would be a good time to take some 1-minute comments here and there. And then Dominic, I think we'll get into the documentation that's been here. So I'm taking a little, some public views on what was in the PowerPoint.
And we have someone with their hand raised. It is Dr. Linda Fatemi. Your mic is open. You can unmute yourself.
Thank you so much. Thank you so much, Brenda, for such a comprehensive overview. I think one of the only comments I have is where you had the slide for the death doulas and, having different routes of training. What we're finding in our academy as it's rolling right now, and it's a New Mexico original New Mexico Academy for Psychedelics through Conscious Physician, is having all these professionals together creates such rich discussion and cross-pollination of different disciplines. So it makes it a multidisciplinary approach where the doctor isn't thinking about a particular thing that the death doula is thinking about, or the nurse, or the, the social worker or the therapist. And where I see, our first responders who have such rich experiences that they're sharing with us. So I think having everybody on board together, having these rich discussions have been really awesome. But I do see also some particular branches of programs being dedicated for, some hours to those particular professions, maybe to have a more connection in that way too. So just some thoughts. Thank you so much.
Thank you for that. I agree that what I'm looking at here is attending all of our previous meetings and seeing, like you said, a cross-pollination of professionals and their specialties. I think it is very important to have all of this education laid out in a way where everyone can learn more about psilocybin and how it's going to be used. So I don't have any really firm ways of doing things, because this is why we're having these meetings, is to get everyone's input and to change things the way we need to, and let it flow and let it evolve according to the Department of Health and our community. So yes, thank you so much for that comment.
Deb Thorne put on the chat Dr. Linda Fatemi, as with the 3 training programs, I've personally received having a robust variety of faculty on board is vital to delivering a solid certification program.
Well, thank you, Deb. Thank you for your input on that too. I think so too. I think having a staff on board with you know, their expertise and professionalism would be great to have and incorporate all of this into it. Absolutely. So I think we're moving along here. Okay, it's 1:27. Because I want to leave time here to go over the document as well. Are there any other comments before we move on to the document?
Walton raised his hand. Let me unmute, allow your mic. You can unmute yourself.
Okay, sorry about that. I was unmuting. Yeah, just one comment there real quick. I just want to also make sure that, or I would suggest that we make a pathway for people like myself, first responders, EMTs, that have experience in this area, but then are also working in a peer support role for first responders and people like that. So just a suggestion. Thank you.
Thank you. Thank you very much.
Patricia has her hand raised. Let me allow her mic. You can unmute yourself, Patricia.
Hi, can you hear me?
Yes.
Okay, perfect. I did want to mention, I don't know if it's just me, but I can't chat. It says chat is only available during the meeting. So I don't know if others are having that issue. And then, oh, did you want to say something, Dominic?
Yeah, I was just going to say, I mean, we have had other people speak in the chat, so I'm not sure what that is, but we'll see if we can figure out what might be happening with regard to that.
Okay, I can also rejoin. But I also, like Paul, wanted to mention, I didn't know what you meant by paraprofessionals, but I'm someone who is not a traditionally licensed, but has a lot of lived experience and studies and done 2 other programs for education. So I also just wanted to like open that up. I don't know if you've included that in your considerations, but for like non-medical professionals or people that don't have advanced formal education.
Oh, yeah. Thank you for asking about that. Well, co-facilitators and paraprofessionals is that you don't necessarily have a degree in anything. Peer support workers, I've worked with peer support workers in addiction, and that required, I believe, like 40 hours. So I think as time goes on, if people don't have a certificate or a degree, but would like to be involved and provide care and support, I'm really looking at that very, very closely, because we're going to need people that can co-facilitate or within a training program that will have people come in with just knowing that they're going to be learning some special skills to help co-facilitate or give some peer support.
Yeah, okay, thank you. I guess for me specifically, my training has been in facilitation, and that's where I have experience. So I just want to make the request for people that don't have like I said, formal education to be considered.
Can I ask you, are you like, do you have a certification or any training in your background doing it?
I've trained in like trauma-informed body work.
Oh, yeah.
A lot of energetic work. Yeah. And even in
yeah.
the spiritual realm, I saw you had a spiritual thing, so I don't know the definition of that. But I was just curious in that way.
Yeah, I would love to see that. I would love to have something, a program implemented to include people like yourself in this. I know of a few people that would like to take some coursework we have to determine what that will be, but I think this will also be included.
Yeah. Okay. And I've also taken like 2 formal facilitation programs. They just
Oh,
aren't
wonderful.
certification formally. So
Yeah.
yeah, thank you.
Oh, excellent. Thank you.
Dr. Ann Metz, your mic's you can unmute yourself.
Great. Hi, my name is Dr. Ann Metz, and I'm an LPC. I live in Taos County, and I'm certified as a clinical facilitator up in Colorado. I think one thing I hope people keep in mind that makes New Mexico's program unique, and I think really is something that we should try to account for when we're coming up with a training program, is the fact that everyone who will be going through this program, with the exception of kind of end-of-life care, will have a psychiatric condition. And so it's a more vulnerable population, perhaps, than, are necessarily coming in for services in either Colorado or in Oregon. And so I do think that we want to make sure that the training is robust enough so that the client population that we're serving, people with, established diagnoses, are getting appropriate care, and that the people that are working with them are adequately trained. So just putting that out there, I'm glad there are some options for co-facilitation for paraprofessionals. But just want to make sure that scope of practice is respected within the professions.
Thank you, doctor. Thank you for that.
And James Brown has your mute. You can unmute yourself.
Brenda, thank you for this giant task on. You're so amazing. We do appreciate you so much. Just a couple comments on my end today on this to start out. Are we looking at a non-directive approach? What kind of facilitation are we going to be doing in these programs? It's something to look at. Is it non-directive? Is there touch allowed? If there is, what is that defined as? And then the other thing that I would like to bring up today is like total hours. What are we looking at? Total hours for the curriculum itself? I'm sure you guys have an idea, but that's something to discuss. And then ongoing. There's a variety of things ongoing. Colorado has something that's where they continue the facilitations, education, and is that something that we're going to require, as far as for our facilitators or our service center owners, are they going to be required to, get hours in addition every year to facilitation? That one-time training is great, but I have a big belief on continued education because it does change, and we're in a current state of change with psychedelics. And so my thing is to, vote for that or voice my opinion towards that, continuation down the line for as that looks out. But thank you so much for your time, everybody.
Oh, thank you, James, and thank you for that. In the documentation that we're going to be pulling up here pretty soon, and the reason why I kind of wanted to do this in the middle a little bit to kind of like spark, our creativity in developing this. And of course, yes, I as a clinician, every 2 years I have to renew my license. I have to do at least 40 CEUs, with 12 of them being ethics. I think continuing education is a big part of this because, as you know, with all of the developments and research behind psilocybin, there'll be more and more things that are going to be changing as we grow and learn more about how we need to approach our education and training and start to establish that in a very formal way so that we're meeting all of the standards, all of the ethics, all of the care that we need to do to provide our patients or our other people that we need to treat. So I think everyone's bringing up some really good points here. This is going to be something that is going to be standardized with the Department of Health. So I'm hoping that with your input, we can create a nice program that will include safety. Yes, of course, what someone was saying earlier, what is touch going to be? Are we going to allow touch? Well, how much of that are we going to allow? What our patients are going to be comfortable with? It's going to be a very, very multiple disciplinary type of thing. But if you yourself are a professional and you know that you have to keep your license up every year by taking other classes too, the psilocybin program should not be any different. We should be able to have like a training every 2 years just to keep on top of this. Any other questions?
We have a few hands raised, but I'm going to read off the chat. Ellen posted just that the training is affordable, probably goes with equity and access, but affordability is crucial. And a question from Lori, how soon do you expect a course to be available in New Mexico?
Question. I don't know at this time when exactly. We don't really have an idea yet, but as Dominic has said in previous meetings, that we're trying to get this done, right, Dominic, before this year is out. So this is why I'm really jumping on all of these points today, is so that we could have a working document that each meeting that we have, we could go in there and edit it, add to things, make adjustments, reword things the way they need to be properly worded. What kind of standards are we going to be in place? And also too, the cost of training. What is how much is this going to cost, especially people who are starting from the beginning of their training, and how many hours? Who's going to be teaching this? Where are we going to be teaching this? So we really need to come together as a community to really cut through all of this and find, of course, this is not going to be perfect, but we have to meet a consensus of what this is going to be, and look at the budget and see how much money we have in order to train people. So, and I know training is very, we have to do, for some people, we would have to do a practicum. Other people haven't started any type of training yet, and that's what we want to establish here in New Mexico. However, there could be a population out there that's here in New Mexico that's in between. They're already training in other states. So how are we going to bring those people in that are like in between this year right now? And how are we going to look at the requirements that they are learning that we can transfer over to here to New Mexico? And then we have, people like myself that are already certified in training in psychedelics in general. I mean, some people are trained in ketamine, some people are trained in MDMA, some people are trained in psilocybin and various other things. And then we have traditional trainings as well, and what that's going to look like. How are we going to prove this to and appease the Department of Health, and make that so that everybody has met requirements for safety and ethics and et cetera.
And just to add into that, Brenda, this is Dominic, for those who may be just on their phones and can't see who's speaking. But there's a lot of messages in the chat if the trainings will involve various other items, if they're being modeled after specific programs, different definitions, things like that. And remember, that's exactly what this is for. We have not predetermined what types of training are required. These are ideas. Some of these are just starting points as we move through this. And so if you have suggestions or ideas about particular types of trainings or models, that's the sort of thing to be proposing as the meetings move forward. But the idea is that we want to ensure that we're getting as many ideas that we can, and to sort of sift through them, and not to necessarily be not necessarily to have predetermined ideas, because sometimes the things that are most important are the things that just sort of arrive organically and naturally. And so we want to make sure to have that. And for those who are saying where to put these items, we will be having links that we are going to be putting up into the chat a little bit later on how to reach the program, and where you can send information and items and how to do so. So just for everybody's information on that, we will post that here shortly.
Thank you, Dominic. Thank you for that. So, are
Do you
there
want me
any more?
to the raised hands? I have two more.
Okay, go ahead.
James, you can unmute yourself.
Hello, can everybody hear me all right?
Yes.
Hi, good afternoon. Brenda, thank you so much for doing an amazing opening, and I really appreciate the comprehensive work that you've done. One thing I would really recommend, and I think I've spoken about it in a previous meeting, but was a recommendation for a centralized registry to track individuals that are delivering psilocybin services. I'm just going to bring up, there's a incident with a phase 2 MDMA-assisted psychotherapy that was conducted by MAPS, and I personally believe that there were boundary violations that occurred, and a facilitator registry would really help ensure earlier detection, transparency, and making sure that appropriate actions are being followed up. I think it's super important that we protect the patients that need it the most, and harm reduction is absolutely imperative. We're human beings, and certain people might have nefarious behaviors, and there's certainly a power dynamic involved with psychedelics, specifically psilocybin. So I would really appreciate any thoughts or comments regarding this idea. Thank you very much for your time.
Thank you, James. I'm very well aware of that incident, and this is something that happens in many professions, where there are unscrupulous people that kind of fall through the cracks and are not held or are not had a sufficient background check or something. It's a new incident that happens. But I think a registry is an interesting idea. I haven't thought about that. But yeah, we might want to take a close look at that as well. Thank you.
Thank you very much. And it's interesting going back to that touch conversation. Just because somebody consents for touch prior to their session, they might change their mind while they're in the actual session. And so I think even defining what a hug standing up is very different from what a hug is laying down. So just some points to really consider. Thank you again.
Well, thank you. I think what you brought up is very, very important, because especially those in the professions of somatic healing or masseuse or even medical doctors, touch is a very interesting subject to get into with discussing that with a client. And some people have a lot of trauma around touch. So thank you for that, James.
Shane, your mic's unmuted. You can unmute yourself.
Yeah, I had to step out for a second. I had to restart my computer because it wasn't allowing me to type anything into the chat. But so I don't know if this has been covered, but are we going to have a process where we submit, like I'm certified through Being True to Yourself, an organization out of Colorado as an integration coach. They're recognized by Oregon and by Colorado already, so I'm assuming they'll be recognized by New Mexico. But how would we submit our certification to see that it's going to be approved? And then how long would that approval, or do we know yet how long that approval process will take?
Well, we don't know anything as yet. I mean, in the document that maybe this would be a good time after we're done with all the questions, bring up the document that I wrote. Of course, this is not in stone yet. Saying that it would be. But this is for us to go in there and really edit and modify it the way it needs to be. I think when it comes to recognizing like certain curriculum, for instance, how that would transfer to what New Mexico wants and needs as far as uh, transferring any, like, I'm not saying credits or anything like that, but just having like a transfer of what someone has gone through in training and education. We'll be taking, I think, a close look at that.
Thank you.
Okay, anyone else?
I think that's it for now.
Okay, Dominic, do you want to bring up that the document?
I am doing so. Give it the system just a minute to come
right.
up.
Thank you.
Just so everybody knows, the text may be a little small when it first comes up. I will be expanding it. And hopefully now everyone can see it. Can people see the document? Yes, okay, I'm seeing some thumbs up. Thank you. Okay. And Brenda, how would you like to go through this? Would you like me to go ahead and read as we go through the sections?
If you like, if you're not too tired yet.
No. Not a problem at all. And so this is the Education and Training Psilocybin Committee working document. And the purpose of the document is to provide professional, collaborative framework to guide a committee in developing the educational standards and foundational knowledge related to psilocybin-assisted mental health care. And the second part of that is training pathways, competency development, and supervised practice models for therapists, death doulas, medical professionals, indigenous healers, pastors, clergy, and spiritual care providers, and co-facilitators, paraprofessionals. The framework is designed to align with New Mexico Department of Health Advisory Board norms and public health standards, support portability and reciprocity for qualified professionals trained in other jurisdictions, provide sufficient structure for program approval, funding, and oversight while remaining adaptable as evidence and regulation evolve. The intent is to support ethical, culturally responsive, trauma-informed, and evidence-informed approaches while respecting indigenous knowledge systems, spiritual care traditions, professional scopes of practice, and evolving statutory and regulatory requirements. And I'll stop there in case there's questions so far. Okay, I think we have one person.
There is a hand raised. Ellen, you can unmute yourself.
Thanks. My question is just about the terminology mental health care. I understand that most of what we're looking at is mental health care, but obviously the research is changing, and it was my understanding that we would continue to really explore pain issues and some of the other things that psilocybin is being used for, and even end of life care may or may not be considered. Actually, I know it's a lot of times anxiety driven, but it's not necessarily mental health care. And is that terminology something that we want to consider? Is it psilocybin assisted care or psilocybin assisted therapy, or something that maybe isn't like mental health specific thing?
Good question. Dominic, so I think what we're trying to do at this moment is we could include it. What do you think, Dominic?
I think the question Ellen is trying to get at, and Ellen, I don't mean to put words in your mouth, and please correct me if I am incorrect is just really that it should be knowledge related to psilocybin assisted care, that it shouldn't just be limited necessarily to mental health, because there could be other conditions down the road, such as pain or other, somatic type issues or body issues. And so just really to take that portion out, if that makes sense. Am I correct on that?
Yes, that's what I was saying.
Okay,
Thank you.
perfect. So really just striking that part of it, taking the mental health out and just leaving it as psilocybin assisted care.
Thank you. Thank you for that. Because I too work with many people who are homebound and deal with a lot of pain issues. And yeah, mental and physical are intertwined. However, yeah, psilocybin could definitely work with physical issues as well. Thank you.
Okay. So continuing on to the guiding principles, all education and training developed under this framework should align with the following principles: safety and ethics, prioritizing physical, psychological, cultural, spiritual, and moral safety; equity and access, reducing barriers for historically marginalized communities; cultural humility and respect, honoring indigenous knowledge, sovereignty, lineage-based practices, and diverse spiritual traditions; trauma-informed care, recognizing the prevalence of trauma and avoiding reharm; interdisciplinary collaboration, valuing distinct clinical, spiritual, cultural, and community roles while fostering shared understanding; evidence-informed practice, integrating research and data, lived experience, clinical wisdom, and pastoral spiritual care frameworks; scope of practice clarity, clear boundaries based on licensure, ordination, certification, and role. And I'll pause there in case there are any questions. Okay, I don't see any, so I will continue on. So for the educational piece, and I will just go through this, but if we do have the mental health care portion in here, we can edit that on as we move forward. So if I do read that and it's specific on there, just know we'll work on editing that portion. So part one, overview. Part one establishes shared foundational knowledge for all participants, regardless of professional background. Education is didactic in nature and does not authorize clinical facilitation or sacramental practice. Target audience: psychotherapists and mental health clinicians, indigenous healers and cultural practitioners, pastors, clergy, chaplains, and spiritual care providers, death doulas and end-of-life professionals, physicians and medical providers, paraprofessionals and co-facilitators, policymakers, administrators, and program staff, optional, first responders, EMTs, law enforcement, firefighters, etc. Part 1, Learning Objectives. Participants completing Part 1 education should be able to describe the historical, cultural, spiritual, and contemporary use of psilocybin, understand basic neurobiological and psychological mechanisms of action, identify indicators, contraindications, and risk factors, explain ethical considerations, informed consent, and power dynamics, recognize the role of setting, preparation, ritual, and integration, understand legal and regulatory frameworks relevant to their jurisdiction and role. And just to a comment that's in the chat from Shane about where would integration coaches fit. I think, Shane, that would depend on what other potential licensure they may have, because they may actually be potentially in different categories. For example, they might be in paraprofessional. They also may be in a medical professional category. So I think it would depend if they have other licensures as well. Okay, I'll move on to the next set. Part 1, the core educational domains. History and cultural context.
There is a question.
Oh, great. Go on ahead.
So in the chat, Shane put, where would integration coaches fit in the target audience list?
Yeah, I had already answered that, Carmen.
Okay, oh, sorry. And I'm muting James. You can unmute yourself, James.
Hey, Dominic, on that one, does it say medical providers or is it medical professionals? I wasn't sure if it, I just want to make sure that was clarified.
It says providers. Yeah.
Right. So I want to make sure that that my thought was to add professionals just so that we could include other people there. That's all.
Absolutely not a problem.
Thank you.
Yeah. Thank you, James. Okay, educational domains. History and cultural context. Indigenous and ceremonial use of psilocybin-containing mushrooms. Spiritual, sacramental, and contemplative frameworks across cultures. Impact of colonization, criminalization, and prohibition. Contemporary medical, spiritual, and decriminalization movements. Ethical issues related to cultural and spiritual approbation. Neuroscience and psychology. Pharmacology and neurobiology of psilocybin. Effects on perception, emotion, cognition, spirituality, and sense of self. Therapeutic and meaning-making mechanisms, for example, neuroplasticity, insight, and existential processing. Mental health and spiritual care applications. Depression, anxiety, PTSD, end-of-life distress, addiction, trauma, moral injury, and existential suffering. Current research, evidence, and limitations, and the interfaces between psychotherapy, spiritual counseling, cultural and pastoral care. Safety screening and risk mitigation. Psychological and medical contraindications. Medication interactions. Adverse events and crisis response basics. Referral pathways between or among clinical, medical, and spiritual care providers. Ethics, consent, and power dynamics. Informed consent models across clinical and non-clinical roles, dual relationships and boundary management, vulnerability during non-ordinary and spiritual significant states, consent for touch preferences within ethical boundaries. And just to check in the chat, I did miss a little here. Jamie asking, is there a role for pharmacists? I think that would fall in under the medical professionals aspect on that at this time. And change to Ellen to healthcare professionals to include that. Nurses and nurse practitioners are technically not medical. Again, I think in a broader term, from a Department of Health standpoint, we do actually consider them to be medical. So I'm not sure that change needs to be there, but that's something this group can decide. It's going to be important to get clear about if this is non-directive approach with the language about spiritual and the boundaries around this. So I think we have that there. And then Deb, sorry, I can't see that little post there, having a definition. Sorry, it's an image that has the defining clinicians and actually includes that in there. And again, just as a reminder to everybody, what this really is doing is it's setting sort of the framework. And so as we start going through more of this and we start looking at it, there are those definitions can be added in so that it has information as far as who is considered exactly professionals, which language specifically to use. This is really more of an overall general framework on that with regard to that. And I do see Deb has her hand raised. So Carmen, if you could unmute Deb and then let Deb speak.
Carmen had to step out for a second. I can do that. Deb, your mic has been enabled. Please speak unmute yourself when you're ready. Deb, your mic isn't enabled. Please unmute yourself when you're ready to speak.
I think she put in the chat that she would share via email. I think
okay.
Defining clinicians,
Great.
I think that's what she was trying to say.
Perfect. Thank you, Deb.
Yeah, thank you.
Thank you. Okay. Legal and regulatory overview are federal versus state law considerations, professional licensing, ordination, and institutional accountability implications, documentation and reporting requirements as applicable. The Part 1 educational methods, lectures and seminars, live and asynchronous, assigned readings and multimedia resources, case examples and facilitated discussion, panels including Indigenous spiritual community and lived experience voices, knowledge checks and reflective exercises, non-punitive, documentation and completion standards, certificate of completion documenting hours and domains covered, attestation of participation and adherence to ethical standards, documentation suitable for regulatory review, funding compliance, or reciprocity evaluation. And that's the end of, and again, remember everybody, this is just a beginning. There are other things that I'm sure as the discussions go on that can be added on in. And one of the things, just as we go through and we pull, for example, the minutes and information from the chat, you know, those are the kinds of informations, even if we don't call it out specifically verbally, that we do look at as far as for addition into various documents and items. So even if we miss something, we do, in the meeting, we do go back to review to make sure that we're including everything. Any questions so far up to this point? Okay, so training, skills-based training, competency development, and supervised practice. Part 2 overview. The Part 2 focuses on skills-based training and competency development. Participation in Part 2 requires completion of Part 1 or an approved equivalent and adherence to role-specific eligibility criteria. Training does not imply authorization beyond legal, professional, or spiritual scope of practice. Training tracks. Training pathways should be tailored while maintaining shared core competencies. Tracks may overlap through interdisciplinary collaboration while maintaining scope of practice boundaries. Psychotherapists and mental health clinicians, licensed or license eligible professionals, Indigenous healers and cultural practitioners recognized by community, nation, Pueblo, tribe, or lineage. Participation defined by self-determination, sovereignty, and protection of cultural knowledge. Pastors, clergy, chaplains, and spiritual care providers, ordained, endorsed, or formally recognized by a faith tradition or spiritual community. Practice limited to spiritual counseling, pastoral care, and religious or existential support. Participation does not authorize medical or psychotherapeutic practice. Death doulas and end-of-life professionals, certified, licensed, or community recognized practitioners. Physicians and medical providers, MD, DO, NP, PA, or equivalent. Co-facilitators, paraprofessionals, individuals supporting preparation, session support, and integration under defined supervision. And then next section is core training competencies, all tracks. Oh, and I do see that we have a hand raised.
James, your mic's been enabled. You can unmute yourself.
Thank you again. And Dominic and Brenda, back to that language prior right there. Would it be again medical professionals right there again? And then would we open that up to, like, again, the RNs, the pharmacists, others that are those professionals per se?
And James, as I said, we'll go through and edit to ensure that language is consistent throughout. That's, yeah, it just, trying to do it on the fly while reading just is not always going to happen.
That's why I'm having you do this, Dominic.
Thank you.
Yeah,
it was more my ADD kicking, sorry.
Sure, not a problem, and I totally get it, and I appreciate it too. And in fact, now the great part, as I mentioned before, we do go back through to pick the comments. So now when we get to this part, as we go through, it'll be the reminder in case we missed it. And then I do see in the comment, there's a couple of items which just to sort of do this are about practicums and about diagnoses, ensuring there's information about that to be able to include that, and for a definition of spiritual community. And just as a note, all of these will actually need to be defined. Some of them may already have other definitions in regulation and law. For example, MDs, LPNs, that sort of thing, went from a licensure, but things that do not will need to get definitions. So it's a great question, and one of the ones that at perhaps a future meeting can be, what exactly are these definitions? And similar with regard to, the addition of things like trauma-informed and somatic practitioners, that sort of listings. Okay, so core training competencies, preparation skills, establishing trust and alliance within role boundaries, psychoeducation and expectation setting, cultural, spiritual, and existential preparation considerations. Facilitation and support, presence, non-directive support and attunement, managing challenging psychological or spiritual experiences, somatic and grounding techniques, integration support, meaning making and narrative processing, supporting values-based and behavioral change, referral and continuity of care across discipline, ethics and professional conduct, scope of practice boundaries, confidentiality and documentation, power, transference, countertransference, and spiritual authority. Role-specific training elements. Oh, and before I do that, just another item, Denali, they are not necessarily intended to be exhaustive at the moment, and noted about the DOMs to be included. So role-specific training elements, psychotherapists, clinical assessment and treatment planning, trauma-sensitive interventions, integration with ongoing psychotherapy, indigenous healers, protection of ceremonial knowledge, community accountability structures, optional interfaces with Western systems, pastors, clergy, chaplains, spiritual assessment and pastoral presence, supporting faith-based existential and moral meaning making, navigating spiritual crises, discernment and integration, ethical boundaries between pastoral care and psychotherapy, death doulas, existential and spiritual distress support, family systems and caregiver inclusion, end-of-life integration practices, medical providers, medical screening and clearance, monitoring physiological responses, coordination with mental health and spiritual care providers. Am I missing anything in the chat? Sorry, when I have to go back and forth between two screens, it takes me a moment for my eyes to adjust. I do not see anything else in the chat. Any hands raised? I don't see any hands raised. Okay. Training methods. Experiential learning, non-drug based unless legally authorized, supervised practicum, mentorship, or apprentice models, case consultation. Oh, sorry, Brenda.
Maybe we could put in the training practicum because I think I did not put anything in the training methods for practicum. So maybe we can add, yeah.
Oh, you do have it. It's
I do
the
have
second
it.
bullet part.
Oh, the second. Okay.
Is
all right.
Supervised practicum.
Okay.
So
Thank you.
Yeah,
I missed it. I wrote so much that it's like it's a lot. Thank you.
It is a lot. It's a good outline, and it's easy to miss. And actually, somebody earlier had I think it was Catherine, had mentioned about making sure that there was practicum in there, or it may have been Deb. I'm not really sure who. That was quite a bit back. Oh, Deb has about mentorships, which I think that may be something to add on in. Oh, actually, it is there right after practicum. So that is there. So yeah. Anyway, so I'll start on that line because I forgot exactly where I was, but supervised practicum, mentorships, or apprenticeship models, case consultation and interdisciplinary learning groups, reflective practice, ethics review, and self-assessment. Clear documentation of hours, competencies, and supervision. Reciprocity and recognition of prior training. This framework supports reciprocity pathways for clinicians, medical providers, and spiritual care professionals with prior psychedelic-related education or training completed in other jurisdiction. Documentation for reciprocity review, i.e. umbrella of proof. Certificates of completion or transcripts. Training syllabi or curriculum outlines. Documentation of supervised practice or pastoral training where applicable. Professional license, ordination, or endorsement verification. Attestation of adherence to ethical and safety standards. Reciprocity does not supersede New Mexico licensure requirements, statutory authority, or scope of practice limitations. Governance and oversight. Oversight by an advisory board, steering committee, or NMDOH designated body. Inclusion of Indigenous, clinical, medical, spiritual, and community representatives. Transparent conflict of interest policies. Regular review and updates based on emerging evidence, community feedback, and regulatory changes. And just as the final note on this document is intended as a collaborative foundation, does not replace legal, medical, spiritual, or professional regulatory guidance. I would also say that this is a good basis to start, and that these are different ideas and there will be more. We will see as far as for doing that. And Deb, that's a great comment with regard to interpretation, with regard to ASL and as necessary. It's not just even with regard to ASL, but also other languages needed in addition to that. So thank you for that. Okay, and Brenda, back to you.
Okay, so I'm going to leave this open. There's a lot. We could go back onto the chats here to see if there's anything else we need to put it in here. Let's see, I'm kind of scrolling back here.
Brenda, if I may make just a suggestion, because this is really introducing this to everybody, and I think there's a lot of conversation in the chat, and I don't think we'd be able to get through it all in the time we have remaining. What I would recommend is just more about maybe some of the ideas on it. And what we can do is we can get this document posted in the next few days so that people can then review it and come to the next meeting with more defined ideas rather than us kind of going back and forth on lots of different potentials and ideas. Changes in language are important, and I want to recognize that, but we want to have some of those discussions, but give people time to actually absorb the information. And so I would suggest keeping this a little more presentation and the next meeting be a little more about diving in to some of those details and seeing what we missed. Because I'll say there's a lot in the chat that we can add in that right now is not here. And I would like to be able to recognize that.
Okay, so. Thank you.
We do have a hand up, James.
James,
hello
your
everyone
mic has
again.
been
Sorry.
enabled.
One thing I would say is disabilities. I don't see anything on here about. We run into that with the other programs where you have people with hearing disability or other disabilities for that. I didn't know if that needed to be added somewhere in the program. It was just an idea on that. So that's all I had so far. Thank you.
Yeah, accommodations. Yes.
Yes, accommodations. There you go.
Dr. Linda, your mic has been enabled. You can unmute yourself.
Thank you so much. I think, going off what James was also saying, disabilities, I see all of my patients are disabled. And I know I've brought this back, at the end of life committee as well, but they are disabled. And so the consideration there is very important. And then, for facilitators who have been certified to also navigate for these patients to go to their homes or their place of comfort where they can't get out of the home or their own bed. So I think that should be a consideration for sure, because this is a big population and we have a very much an older population, retired population, and a big end of life population here.
Thank you for that. That's very, very important.
Okay. Do we have others with for comments? By the way, I didn't mean to stifle comments. I mean, I think we should hear them. I just, I think trying to change the document right now while people are still absorbing it, because there's a lot of it, and we want to make sure people are able to actually review it and consider their thoughts on it.
Ellen, your mic has been enabled. You can unmute yourself.
Thanks. I know I put this in the chat, but I just wanted to maybe bring up having some way to train students, because that's one of the things that I don't see happening right now in Colorado or Oregon is I really think that it would help to have at least some sort of a pathway. And again, what students in particular, I don't know that we need to necessarily define any of that, but just really having some sort of a pathway to do some education with students. So not people who are practitioners or clinicians now, but really building the next generation. Thanks.
Lisa, your mic has been enabled. You can unmute yourself.
Hi, I wanted to actually second that. I do believe that, anyone who qualifies, I know you're defining who qualifies, should be able to be trained. There's a difference between training people and licensing people. We have a lot of people from all kinds of backgrounds that come through our training program here in Oregon and in Colorado. And then it's up to them what their path is. And some people are studying to be credentialed and some people are already credentialed. So I think it opens up the doorway, as she mentioned. And I also mentioned this in the chat, but just like, I'd love to see some clarity around the spirituality, because I do love and appreciate that this is a part of the conversation. And with the non-directive approach, if that is the direction that the training programs are going towards, which I do agree is a good one, it really helps to mitigate issues where people become manipulative with people in vulnerable states, whether they do it purposely or unconsciously. That somehow, some way, that there's clear boundaries around how that is, discussed or taught or something around it. And I don't know what that looks like, but I just wanted to name it because it kept coming up for me as the word spiritual is used and non-directive, and just wanted to help support clarity, however that happens. Thank you.
Patricia, your mic has been enabled. You can unmute yourself.
Hi, thank you again. I really like the idea that Dominic mentioned about, taking focused topics, and I wanted to ask the question is, would it be possible to kind of schedule or know, like, this date we're talking about this category or this category, and that way, for those that can't always join, we can kind of plan around that, or just sort of know what we might want to prepare to share.
James, your mic has been enabled. You can unmute yourself.
Hello, everyone, again. Just my thought again on this, Brenda and Dom and team, really is behind access again. You know, as we go through these steps and as we go through these documents, I want to make sure everybody is, you know, refocusing back on that individual, you know, training facility. As far as we need some standards that every training facility will be able to provide those standards, and I'm sure we'll create those. But just to think about also when we're doing this, the person, you know, we have a bunch of different, we have the 4 different modalities we can treat. And with that, you know, is there anything I liked with Dr. Fatima brought up earlier about just, again, to echo that on specifics per disease state? I think it's going to be very specific that each one's going to need its own educational objectives, of course, and just to focus back on that again. And then also, again, about access across the state. There's a lot of providers in rural areas here in New Mexico that we need them to have access virtually, of course, but also with that practicum, you know, when they're thinking about where these practicums going to be held and access to those practicums and the total cost to that individual. Again, we're in New Mexico, you know, besides the equity fund, how else can we do this? You know, and how else can we continue? Again, I like that continuation, long-term thought. You know, we're doing this for the future of New Mexicans and everybody else. So, thank you.
And Jen Romero had a question. Which committee will be working on community education and outreach? That is, once the program is up and running, how will New Mexicans eligible for the program be informed and engaged with? And then Deb also questioned, would the program allow psilocybin use for the practicum?
These are really, really good questions. And I love that we're diving in so deeply, even in this first meeting, to really take a good close look at how everything's going to start to evolve and work out or not work out. I think when we're talking about the community as a whole and educating and training, I think as things evolve, those things will start to come into focus, especially with you know, how money will be spent, who will be training. I think how things will be trained is something to be discussed in other meetings. I mean, I've worked up a you know, a rubric even on training and education here. So I mean, these things are going to start to culminate as we talk more and more about it. Of course, we're not going to please everybody, but this is a start, and this is where we're going to be making it a New Mexico program. And we're lucky that a lot of people come, a lot of states have done this before us, and that we can extrapolate some of that information and put it with ours. But again, we have a very unique community here of people collaborating and including everybody and trying to make this as accessible to the patients and the clients as we move forward. And I really like what James was saying earlier about the future. You know, as we move along, things are going to evolve and things are going to change. We may even have even stricter regulations or maybe looser regulations. We have to see how this is going to evolve and shape. And I appreciate everyone you know, saying what they need to say and adding into this program.
Have a hand up. Marcy, your your mic has been enabled. You can unmute yourself. Marcy put she's having mic issue. She can't unmute herself.
Okay, if there's anyone else who would like to speak, we can move to them. And then Marcy, if you like, we can try again in a minute. And if not, you can always put your comment in the chat. I also did include just a couple of minutes ago, that if for whatever reason you're not able to unmute, and this goes for anybody, or you just don't want to speak in such a large public meeting, you are welcome to send the written public comment to the program. And I included the email there. The only thing we do ask is please remember to include your full legal name and your organizational affiliations you're representing or may be representing. And then if you're referencing documents from other sources, you do not need to include the whole document, just a working hyperlink and explain the context. And I say that because in the past, some of the documents that we've gotten have been, for example, the full list of Oregon's rules and regulations, which are quite lengthy, and we want to actually cite the specific area that you may be talking about or including in order to help us, and not just say, here's the regulations, take all of them. Let us know what areas you think are good, what you think is bad, what could be improved upon, and then we can take it from there. But we do ask not to include lengthy documents just as text. We have had that happen, and that creates issues for being able to post it for people, because then what occurs is individuals go to read it and they just get overwhelmed with the amount of information. And that's a part of what we're trying to do here, is trying to reduce things down and have starting points so that individuals can actually engage and make sure that they can do things really well.
I have a question that I'd like to pose to everyone out there. We're going to need teachers as well to teach these curriculums. And I just want to know, just a raise of hands, who's ever been in a position where they've taught anything in psychedelics or psilocybin or anything like that?
So far, we have about 8 people who've raised their hands, Brenda.
Oh,
So,
okay. Wonderful. That's fantastic. And maybe
make it 9. Sorry.
Well, maybe some people would be interested in knowing how to become a teacher. We've been concentrating on, this document about what we need to have in training and education, but, maybe having a course, especially for those teachers here in New Mexico, that, we could all get the training, because even people in the DOH for psilocybin would want to take a course from one of our own. And I have I do have another document. I'm still kind of working it out, and I've been attending all of the other meetings too. And one thing I think that is probably one of the many important things is where we'll be teaching. We'll be teaching at the universities. We'll be teaching at community centers or churches, having a place to do this in, and how much is that going to cost, or those types of things. So I think that's you know, part of that is up to the Department of Health to kind of find out what we can do as far as where these, you know, where we can get the knowledge and certified or taught, or however this is going to play out.
James, your mic has been enabled. You can unmute yourself.
Brenda, great question. Actually, my thought here, I've just given it to you guys is, I think the industry is going to drive some of this. There's most programs out there right now are virtual. The program I attended for the PAT therapy was a virtual program. The practicum is where you come in person. So that's where I am, kind of voicing my experiences with this, is that, again, we're living in New Mexico. It's very rural, but people do have virtual ability. And so, if the institution wants to have a brick and mortar, great, but that's very costly and that's up to them. Everybody's not going to be able to go there. But if you have a virtual option, so I'm just going for both options. If they want to, again, have brick and mortar, let that happen. But my idea is to have that virtual option for people in the schools to open up virtually if they so choose. And so I just wanted to kind of voice that out there. That's how I've kind of seen the different programs between, Emerald Valley Institute, Intertrek, IPI, all these programs they're all virtual. And so I just wanted to throw that out there is I'd like to see that option for us in New Mexico as well.
Thank you, James.
Dr. Lida Bateni, your mic has been enabled. You can unmute yourself.
Thank you so much. Yeah, I second that, what James is sharing. In our academy, what we're experiencing is having both in person and virtual during our live sessions has been very powerful, because the in-person sessions are, a few people show up each time, but that interpersonal connection, the wisdom sharing that happens in person is quite powerful. And then we have people from all over the country who are able to also, and all over New Mexico, from north to south and all over, are able to Zoom in as well. And then they have access to replay, and we're CME approved through UNM School of Medicine, so they're able to get that wherever they are. But I think that having options is important, especially for our more remote areas, and having the in-person is very important. Community building and those heartfelt connections are so much stronger when we are in the presence of each other. Thank you.
Thank you. In the comments, Ellen Schimmel said, will practicum be experiential as well? I think that also too, that's, yeah, I wouldn't exclude that. Definitely it would be in the practicum, because a lot, you don't know what is going to come up in your patient or clients. So yeah, I don't see why it would be wouldn't be. I think it would be an essential part of a practicum. Definitely. I think this would be. I think we really don't know quite yet about how all of this is going to look, but yeah, I'm a telehealth counselor, and I have clients all over New Mexico. So a lot of people cannot come to, their town or, a city because of transportation issues. And that also too, disabilities is like that too. I mean, there's people that can't leave their home because of their disability. So I see that we'll probably be actually being in homes with people, and that's an option that we should look at, definitely. Let's see, Catherine Warnock says, I think that practicum should be included both dosing and develop personal relationship with the medicine and guiding others. That's wonderful. Yeah, absolutely. So let's see, anything else that we could, cover here? Oh, I wanted to ask you, Dominic, since we are not going to be meeting in February for our, I'm losing my mind here, losing my track of thought. When will our next meeting be?
Well, that's actually a great question, and that really is up to you and as far as for the committee. The one thing that we have requested for some of the committees that where we don't need to have the regulations immediately, we are focusing on cultivation and testing because, and just for those who have not been in some of those other committees where we've talked about it, from a timeline perspective, for us to be able to have medicine for example, for some of the training potentially, and with regard to for patients by next December, we need to have the cultivation and testing has to occur first. So we're prioritizing that aspect of it so that we can get that out there, get some of those potential cultivators, for example, permitted because it takes time for them to be able to, to be able to cultivate. It's not something that we just say, this cultivator is permitted and suddenly they have, psilocybin mushrooms. It doesn't happen that way, unfortunately. And so we're going to have that time. So we're working on that. So what we've just asked is that the committees just wait until after session, because that will give us some additional time to be able to work through some things. Things like this document, we'll be able to post it and people will have enough time to be able to consider it. So what I would recommend, Brenda, is I would recommend, and sorry, I'm pulling my calendar up while I'm talking here, is potentially either looking at the first week or second week of March. And we do have a couple of meetings that are already scheduled, but we can definitely work around that. If you wanted to keep this same time on a Friday, March 6th from 1 to 3 is open. If you wanted to go with that, or we could look at later dates or other dates even. It doesn't necessarily need to be on Friday, but I will leave that to you to propose.
That's perfect. March 6th at 1 would be perfect. That would give us enough time to think about it. I really love that idea because do you want the rough draft still on the 13th to be posted?
That is the rough draft on the 13th is actually regarding the cultivation and testing. So you don't need for this committee. That's just cultivation and testing. And for those who may have missed it in the main, the primary advisory board meeting is we're working on a rough draft for with regard to the propagation, and that's actually was presented in the propagation committee. Will be up on the website shortly. What we're just doing is we're doing a rough draft with regard to that portion of the outline of what the rules and regulations will sort of look like. And so that can be considered over the next few weeks. But and we'll do the same with regard to the document that was presented today. That'll get posted up in the next few business days so that people can consider it for the meeting on, let me make sure I have it, Friday, March 6th between 1 and 3 o'clock.
That's perfect. Thank you so much for that. I really appreciate all the work that you're doing, Dominic, and everyone else. This has been really a great meeting. Sorry I was late. I was having technical difficulties getting in there and doing this. And my phone was just going off like crazy because I'm in these signal groups. Where are you, Brenda? Where are you? So I apologize for that. Usually I'm in these meetings, no problem. I can get in, no problem. It just so happens that, and I think we were having that yesterday a little bit with Larry's meeting as well. So yeah, these are technical bumps in the road, but at least we all got here, and I really appreciate everyone coming here today and giving a voice to this. And this is how we're going to do it, getting together, discussing what needs to be done and what's right for New Mexico. I think in the beginning of all of this, because I started back in 2015, searching for groups out there that were making an impact on New Mexico, and trying to find people who were actually doing this work. And it was so new that I attended a lecture at UNM for smoking cessation with Dr. Matthew Johnson, and it was very eye-opening. And I'm like going, oh, this is the future. This is what's going to happen to New Mexico. So, and then prior to that, Dr. Straussman did DMT. So New Mexico, as far as education and training, we have been doing it for quite a while. And that's not to think lightly of all the traditional healers that have been doing this for hundreds of years here. So we have to integrate all of this and understand each other and talk about it and start to come together. And this isn't going to happen just because a few people are doing it. It's going to happen with all of us doing it all at the same time, and bring our views and our understanding about this wonderful medicine that has been shoved underground, and it doesn't need to be that way anymore. We can start to study it and work with it and start to heal people the way it's intended to be. So thank you all for being here today. I know we have a few more minutes left, but I know I have that time trying to come on to the call here. But now's the time if anybody else wants to speak up, and this would be an appropriate time to do so.
Okay, not seeing anybody else raising their hands or comments, Brenda. So with that, just on behalf of the department, thank you for chairing the meeting and for doing this. Thank you to everybody who was here and for your input. We're really looking forward to it, and for the, as far as for these drafts moving forward. And just as a little bit of a clarification, so Brenda, because I was reminded of this, is the deadline for the 15th with regard to the draft is actually whatever document that we have that you've created and that we morph as it goes through with the comments on the meeting on the 6th. That's the document that we're talking about as far as draft and outline for the advisory board. So just wanted to clarify that in case anybody who watched that meeting goes, wait, but there was supposed to be something. That's actually what's there. Brenda did a great job in getting it put together early, so that gives us a little extra time. Anyway, thank you to everyone, and Brenda, back to you for any final words.
Well, thank you, everyone. Thank you, Dominic, again. And I know this is a small community of people. New Mexico, I don't know, we have 2 million people here in the state of New Mexico. It's amazing that all of you've come out. We're all showing well, we're not showing our faces here, but we're showing our initials here. And that shows me that how thoughtful and caring all of you are to be a part of this, and you all are a part of this. And I thank you so much for being here today and offering up your knowledge, your experience, your viewpoints to have this all come together and shape New Mexico for the future. Thank you, every one of you. And I'll see you all on March 16th at 1 o'clock sharp. Okay.
Thank you, everybody.
Thank you.